I'm joined by a very special guest because the big question that is being asked is the country in community transmission? Do we need a re-lockdown? Who better than India's top epidemiologist, the former principal of Vellore College, CMC Vellore, Dr. Jayaprakash Muliyil joining me. Appreciate your joining us. The big question, Dr. Muliyil, is simply this. India's cases have crossed 3 lakhs now. We are number 4 in the world in terms of cases. And we're asking the question, are we in community spread? Is it time to stop the denial over it?
I would say this way, there are certain parts of the country who are definitely in community transmission. There's no denying it. And you don't have to be an epidemiologist or a scientist to figure out that cases are spreading across people without any connection with a visitor or a foreign trip. So there is definitely coming in certain areas. But India is a large country. When you put a metric like this, it may not apply to certain areas. Rural area, it may be not there. There may be areas where the disease has not reached yet.
But sir, in the areas where there are reports of community transfer, remember the Delhi health minister has said that they cannot do contact tracing for about 50% of the cases. In such places, is it time to relook at strategy, Dr. Muliyil? Is there a need, as some are suggesting, for a re-lockdown, or is it simply a time to change this lockdown unlock strategy and focus on herd immunity?
To answer the question, you have to remember that many of these areas where we are now calling our hotspots, cities, big cities, they're already in certain type of lockdown. So, and we have not really succeeded in stopping the virus by lockdown. Very stringent lockdown, where people hardly move out of the house, may have some impact, but you have to maintain it for several months. And that is something we cannot afford, or Indians cannot afford. It'll be too hard on our people. So you have to revise your strategy to mitigate the damage in certain other methods.
So you're telling us that you've told us already that community transmission is happening in big cities. You need to revise our strategy. What are those methods, especially for big cities like Delhi, Mumbai, Chennai, Kolkata? These are India's economic hubs in a way. If we fully lock them out, it has a big economic impact. What should be specifically done, Dr. Muliyil, now in these cities?
I think there are very few simple methods that you can do, and practically that's the only thing we can do. First of all, individual protection we know about. We have to keep educating people for that. Number 2, focus is now on the hospitals, or whatever you call them, where you have a battleground going on. And that is where we should focus, because we need, for a little while, the numbers will increase and then it will start dropping. But in the meantime, we need to find places where you can take care of sick patients who come in. Remember, only a small percentage of those infected will need this care. But in terms of number, there will be large number. Everybody won't need ICU care, but at least nursing care, oxygen, and that sort of support we need to be able to offer. Now, I think we are now spending unnecessary time on identifying so-called infection, subclinical cases, even including putting them in hospital. Okay, now that is a wasteful exercise. I think we should support the hospital staff with extra facilities, extra staff, so that our battle for the lives of these patients will be successful.
So you're saying focus on the health infrastructure. The government is also saying, Dr. Muliyil, don't look at the absolute number of cases. Look at the CFR, the case fatality rate. In India, it's just 2.9%. Do you think that's something we can hold on to, or do you think we are simply clutching at straws by saying our mortality rate in India is much lower than some of the Western nations?
the mortality rate is a kind of a difficult thing to go by. The reason is, this is India. When a 75-year-old man develops breathlessness in a slum, will he go to a hospital? Maybe to a nearby private practitioner. It will never come in the records. So it is unlikely that we are going to track down every death cases. The other point is, what is the denominator for calculating mortality rate? Some are sick, some are subclinical cases. So it's so difficult to understand what it means.
Are you telling us today that we are actually underreporting COVID-related deaths, therefore we cannot take this 2.9% case fatality rate at face value, also given that there may be number comorbidity deaths that are also called COVID deaths?
I am saying that 2.9% itself is a faulty figure. Even otherwise, take the numerator. We are not underreporting probably, but we are incapable of getting all of them in our reports. That's the way this country works. We always have problem. And see, for example, somebody has to reach a government facility where a COVID or some other facility where a COVID test is done. Then you confirm the case, and that's where you're going on case. But supposing a person decides to stay at home or go to a local doctor, get some injections and treatment, go home, dies. We will not see those cases. And in rural area, it's even more stark. Okay? So don't expect ever to get a list of COVID cases correctly in Indian context. It is impossible. We have done it and we are aware of it.
So what is the number we should be looking at closely, Dr. Muliyil? Is it therefore the number of cases, recovery rate? What is the number that will give you the conviction that we are moving in the right direction?
I tell you one thing. At the moment, we know there are people dying of COVID. Number one. Number two, some of them would have recovered if they got some reasonable care. I'm not talking about ventilators, reasonable care. So they need to come to hospital, get treated. And now, the point I'm making is, you will not, within the given system, never be able to calculate a case fatality rate which you are quoting for me. It has no meaning. I cannot compare it to anything. It doesn't make any sense. What we'll have to wait is for total mortality once the epidemic dies down. Then we'll get an assessment of damage done by the virus. At the moment, people who come sick into the hospital, we have to look at them and in them reduce the mortality. And that's all we are expected to do.
You know, you're in a sense suggesting the limits that in a situation like this, the health limits, but you've been a proponent of herd immunity. Do you believe therefore it's time for a re-lockdown, or is the whole concept of a lockdown subject to diminishing returns given that there is community transmission? What is the way out? What is the way out? Is it a re-lockdown, or is it simply to live with the virus now and allow herd immunity to set in?
And especially the protection of the elderly. Now that is the only way to go, because there is actually, easiest way, I think is the shorter thing is to say yes to you, because a lockdown is locking down everybody now is going to be counterproductive. It will cause more hardship, and the young and the people who can work and earn, you are putting them in trouble. And even at the best, what you will do is prolong the whole thing. You will delay the events. The moment you lift the tight lockdown, back the whole thing will come. So that is not a solution.
So you're saying a re-lockdown is not a solution. Some stats, Dr. Muliyil, are saying even younger people, though in India, are succumbing to COVID in India. So while you are saying the focus should be on senior citizens, unlike in Western countries, in that age group of 40 to 55, there are people who are succumbing in fairly large numbers in this country.
Yes. When you look at numbers, it is. And I'll tell you how many I expect, if all the deaths come in, to die in India in the urban areas of 1 lakh in India, urban population during the epidemic. But do you know what the population I'm referring to? 15 to 59. That is 90 crore people. In this 90 crore people, there may be 2 lakh deaths, one for urban and 1 lakh for rural. And that is the death that will occur in this age group. In the context is that normally we have annually 3 million deaths in that age group.
You know, Doctor, when you say the headline will be 1 lakh deaths in rural India, 1 lakh deaths in urban India, look at the impact. That headline figure will scare people, will scare our politicians. When people hear you say it, there will be even more scare. I mean, how do you then sort of eliminate the scare and panic that these figures throw up?
That's true, but I'm saying that this is based on the Western statistics. Okay, for example, in rural and urban put together, in the age group 15 to 59, I said the maximum expected death is 2 lakh, as compared to 3 million whom we lose per year in this age group. So you have to look at, relatively speaking, what is it? And we are telling you, there's no way we can prevent it unless you go to a tight lockdown for several months to come. And that would cause more damage and more disease, more deaths due to other conditions. And that is not going to work out.
When do you expect, though, Dr. Muliyil, and this is the big question that's being asked, the curve to flatten in this country? Do you believe it will now start flattening in the next 2 months? Do you see any positive signs?
Not for India as a whole, but I can tell you in Mumbai, this will flatten and go down to 1 early. There are every sign for that happening. And big cities will take the lead in doing that. There must be similar thing happening in smaller corporations and municipalities. I have no clue. It must be there, okay? Because they are not in the limelight, we don't see. And most of the reporting is very, very poor. So the reported number I told you is never going to materialize of so many lakh. Yeah, whole lot of finally at the end of it, they'll say, Dr. Muliyil exaggerated the number because the reported number is going to be very, very much less than what I suggested based on mortality in Europe, especially UK and France.
So in a way, Dr. Muliyil, are you leaving us today with a positive thought? As India crosses this 3 lakh mark, we become the 4th largest country in terms of cases. You seem to be suggesting you've just got to stay the course. In the next 2 months, we will see possibly an ebbing of the crisis, especially in the big cities, but stay the course, allow herd immunity to set in. Don't go in for a lockdown again. Am I correct?
Yes. And it's going to be a fairly good immunity according to what we are hoping to get. Thing is, I'm anxious to make sure that the death rates come down. And the only way you can make sure is to keep the elderly out. These predictions will come down tremendously. Like you said, age group 40 to 50 have to be careful too. But not the whole population. Okay, these 2 sections I said are small proportion of the large population. So this is where our emphasis should be. With the high risk group, take care of them. With the low risk group, function.
Let the low risk groups function as normal. Focus only on the high risk groups is your suggestion rather than any other national lockdown. Once again, Dr. Muliyil, as always, thank you for sharing us with your wisdom. I hope that at that Prime Minister meeting with the Chief Ministers, they'll be listening to your wise words.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.